Welcome to the Poverty and Homelessness Board Executive Committee meeting on Thursday, September 19th, 2024. On the agenda today, after introductions, we do have 5 minutes for public comment. So please put something in the chat if you'd like to make a public comment. Amanda will be going over the COC application. Brittany Manzo, sorry, will be here for the strategic planning update. We will have jurisdictional updates if we have representatives here. The draft agenda for the all-member meeting in October, and a wrap-up. So with that, I am Sean Murphy. I'm the Executive Director of Laurel Hill Center and the co-chair for the Poverty and Homelessness Board. Commissioner Farr is excused today. And Tish, do you want to introduce yourself?
I'm Matthias Smith. I am the formerly homeless youth representative.
Okay, and then did we see if Mayor Venus or Mayor Van Gordon were available yet?
Yeah, doesn't look like it.
Okay.
Yeah.
All right. So with that, we will move it over to public comment. Do we have anybody for public comment? Okay. All right. So we're going to move on from public comment, and we do not have a quorum yet to approve the consent agenda. So I am just going to move it to Amanda.
Okay, great. So some of this you might have heard some of the updates at a previous meeting, but I'd just like to, throughout the competition process, sort of update you all as the board on where we are with our application and sort of what the next steps are. So we did have some things hanging out there the last time I provided an update, and we have finalized now our new projects, which you have a summary in the packet of a little more detail about what those projects will entail. So we've kind of wrapped up kind of making decisions with the COC committee on what new projects we will submit. For the bonus funding, as you might remember, I think I updated that we had a little bit more available this year than we had anticipated, had increased that by about 5%. And so we had to sort of go back to the drawing board and figure out additional projects to submit as the committee had kind of agreed to submit a new project for coordinated entry supportive services only project to support some coordinated entry navigators. But then we still had kind of a balance left over. And so the committee did decide to submit for an expansion of the Bridges on Broadway project. If you remember, that project was funded last year through the fiscal 23 NOFO, but for only a portion of units, 25 units, I believe. And so for this year, they will expand for the additional funding to provide supportive services for the full number of units that will be available, which I think is 57. So this application will include the remaining 32 units that were not COC funded. And that was just because last year we didn't have enough funding to cover all units available. And so with this request, it makes them a little more whole in terms of supportive services. I think it's about $9,000 per unit, which is a good chunk of change to support as renewing funding. And so those are our two bonus projects. Under the bonus funding, we also have the domestic violence bonus funding available, which is a separate pot of money specifically to serve survivors of domestic violence, dating violence, sexual assault, and stalking. We did issue an RFP, request for proposals for projects to be submitted for that, and did not receive any submissions that we could submit. And so we went back to the drawing board on that one as well and brought that to the COC committee and also reviewed with our co-applicants to see if they might be able to submit a project. We unfortunately didn't come up with anything additional in terms of a housing project that could be submitted. So what we proposed was submitting an expansion of the DV coordinated entry project that was funded in the previous fiscal year, similar to that Bridges on Broadway project. It will expand what is existing and what was funded to add additional FTE to operate our coordinated entry, specifically for domestic violence, which, as we know, is really lacking at this moment. It's really hands-off. And so these two grants, if awarded, would really help us support those who are fleeing in particular, to make sure that they can access coordinated entry, access pathways to housing, and really navigate safety and supports in the community. And so that will be our domestic violence bonus opportunity that we will submit. Additionally, we had sort of a last minute request for a reallocation, and that is a voluntary reallocation. We didn't have any projects recommended for formal reallocation this year. We essentially reviewed all of the projects, and while there were some that had some spending issues, it seemed that since those grant periods, those issues have resolved and they anticipate spending in full, and any performance issues we are working with agencies to resolve at this time. And so we didn't feel that it was necessary to reallocate any projects. But St. Vincent de Paul did request to voluntarily reallocate a portion of one of their projects that they just have gotten increases for. And it is sort of a set cost project that they operate through their own housing, so they don't have a need for sort of the increase of funding, and anticipated having a small balance each year with anticipated increases continuing. And so they really felt like that money could be better used in a different project, and the COC committee supported that decision to move that to the Connections Rapid Rehousing Project, which is largely underfunded for the number of units they have. And so that will allow them to expand their case management capacity to support the full number of units they have. So those are all of our new projects. Any questions on that portion?
Amanda, I just had a question, because I know we struggle with the DV portion for a while. Have we gotten any feedback from providers, maybe who specialize in DV, of is that project just not feasible, or should we like focus more on the
Yeah. So I haven't necessarily gotten that specific feedback. I think we can certainly seek that out over the next year or half a year before the next competition to really hopefully build that capacity. Right now, we don't have, like our victim service providers don't currently receive HUD COC funding. And so it will take some work to sort of get them in a place where they're ready to take on those requirements and everything that comes along with it. And there was a lack of interest in sort of taking on all of that at one point. And I imagine that might still be the case, that it's just a lot of requirements under the COC program. And so it takes, you know, a good amount of money. And it's not a huge, it is more this year, but it is only a little bit under 200,000 once we remove our admin portion. And so it's not giant funding in terms of housing projects. And so I think that I imagine that was probably part of the concern as well. And unfortunately, that's just the amount that HUD makes available. And so perhaps we can look at ways to leverage additional funding or seek out other funding sources that could really make a project complete in that way too. So I would imagine those are some of the reasons that we've heard in the past. And I think those are probably still some of the barriers.
Hi, sorry, I'm a little bit late, but I'm here.
we're happy to have you here, because now we have a quorum. So
I was worried about that. I thought you were gonna need me, and I was at home, and anyway, I'm having roof work done, so I could not do this remotely.
Beyond the new projects, where we're at in the application process is really honing in on all the renewal project applications, which are actually due tomorrow. And so we have gotten a portion of those in from our co-applicants, and Lane County, we still have to submit ours and our YHDP homelessness program applications. So the next step is to sort of get all of those in. There's a review process to make sure those meet quality standards and accuracy before those get submitted before the end of September. Those have to be submitted 30 days prior to the deadline. And then our ranking meeting is scheduled with the COC committee, where we have to rank all of our renewals and new projects, and that's scheduled for October 3rd, 2 weeks from today. So finalizing all of that, and then on the back end, sort of still working on that narrative portion that gets submitted as well. And we anticipate having our first draft done maybe before before Monday. And then we kind of take a look internally, make additional edits, kind of really make sure everything's in there that we want it to be, and that will be brought to the full committee, the PHB in October for approval, and then it starts routing immediately after that for submission in October. So I think we're on track for the most part. There's a lot of moving pieces this year, but we're getting there. And the COC builds opportunity is still out for RFP. I think that closes maybe next week, I want to say.
Can you just give a brief update on that? On what that is?
Yeah,
Sorry.
the COC builds opportunity was a separate notice of funding, NOFO, specifically for new construction, acquisition, or rehab under the COC program. So it follows all of the same COC program guidelines, but is that specific funding category for building or rehabbing permanent housing specifically. And so we put that, essentially we just put that out exactly as the application is, which was HUD's recommendation. And so it really requires that someone is using, right, a developer, site control, is going to do the environmental review process, all of those things that go along, and also looking to leverage funding from additional resources from healthcare and other housing resources. And so really is a robust application, and we're hoping we have something to submit so that we can expand the permanent housing that's out there and available under the COC program. But it is a hefty application, I would say. So we will see, but I think it closes next week. And then we have until November to submit it to HUD. So we will work with whoever submits it to finalize the actual final application.
Any questions or comments? Mayor Menace, if you don't mind, please. I'd like to go back up now so that we can vote to approve the consent agenda. If you guys are. Thanks for doing that. Yeah, I always ask. So can I get a motion to approve the consent agenda?
I move to approve the consent agenda.
A second.
Oh, I guess there's no dissension because there's only three of us. So we are all in favor. Thank you. We are moving fast today, but hopefully, Brittany, you are ready.
I am. Thank you so much. Thank you so much, Sean. I apologize that I'm not on video today. To be totally honest with you, I am headed into a family vacation and I stayed up way too late last night digging into workshop data. I am not saying that for kudos, but I stayed up way too late and it just threw off. So I am not video ready. I am otherwise hopefully here with what you guys need. But if there's one group I could admit that to today, it feels like you guys.
And
I'm gonna share my screen. Yeah.
Before you get started, are you comfortable with folks asking questions throughout or at the end or?
Absolutely. I will, because of my screen setup, so you guys should be able to see our slide setup. I can see you on this side, so just chime in. I'm okay with being interrupted and managing folks as we figure out who goes first, to make sure that we create space for discussion. I do have a couple of discussion questions teed up for us for you to think about throughout. If you want to pause to talk about logistics or clarify process or dig in a little bit deeper, we can create space for that. And these questions can be, the discussion time can be expanded and shrunk as we need to. Sean, given where we are in the agenda, what time would it be ideal for us to wrap up by?
Okay, now you're gonna have me do math.
I
we would be it would be probably about an hour.
That'd be great.
Yeah,
Yeah.
That'd be great.
okay.
and I just wanted the people who are virtual, James is manning the chat if you have questions or your hand up. And now I turn
Thank you so much, James. Thank you. Thank you so much. It's great. It's great to see you all in the room. So as I was saying, these are the questions that we'll dig into. I'm going to share what we found. I'm going to do a progress update so that we can, get grounded in where we are in this process. And then I'm going to share a little bit of our early findings as far as values and vision. Since we have an hour, maybe we can get into what's working well and what's not working well, as we've heard it from workshops, but I also want to create space for discussion around that with this group. And since we do have time, it would be great. And I know, James, this is getting into your agenda item, to just get on the same page as far as how we would like to engage the broader PHP come October and again in December. So just plotting a little bit of that out. But I'm going to close your eyes. If you get motion sickness, I'm going to flip back in these slides and start from the start. So if you have any questions along the way, please chime in. Those are the questions that we'll create intentional space for, but please, by all means, this is your time. So just reviewing the purpose, the scope of the strategic plan as we set it out together earlier this summer. So the process is to guide, sustain, and improve Lane County's efforts to prevent and end homelessness, and assist people of low incomes in meeting their basic needs and achieving self-sufficiency. And so our process has been to start architecting a strategic plan that answers the three basic questions of a strategic plan. I'm sorry, there we go. The three basic questions of a strategic plan. Where are we? Reflecting to make sure we're grounded and clear about where we're starting from, having a clear vision and aims to guide our efforts, to understand our efforts, or the how will we get there. And the last piece that has felt important to Lane County all along is that we have space for movement and pivot so that this plan can stay alive, but we can stay on track toward meeting our collective goals. And so given, just again, to ground us in where we are in time here, over the last 3 months or so, we've done a lot of key stakeholder engagement. So with PHB members, through the MAC group, with League, frontline service providers, we did a series of workshops that you'll hear a bit more about in just a minute. An initial systems and stakeholder analysis, just from the perspective of the external perspective that I bring and the National Alliance to End Homelessness has brought through the System Design Clinic, which, as you may have felt in the room last week, we're starting to pivot or build the energy to pivot toward what are our priorities, given our reach and understanding of where we are as a community, who's at the table, whose priorities are where. We're really setting the table now toward what are we going to hone in on. So this conversation today is an initial recap of what we found so far, and it's to be further synthesized. You'll see we still have a little bit of phase 1 engagement to wrap up, but we're moving into that. So this is all kind of a flexible timeline, but I want you all to be key decision makers in deciding, who gets engaged when and how. That there are some beautiful ideas from the community about how we move forward into phase 2, which is broader community engagement. So for example, you'll see on our next slide, I haven't had a chance to meet one-on-one with the chamber yet to dig into their plans. I haven't had a chance to meet with Homes for Good yet. I know that they were priorities named by this group. This is, just one of those moments where the one woman show is a challenge, that there's only one of me. But now that we have a little bit of a grounding on where the sector is, the direct service providers, members of the PHB, League, MAC group members, the city of Eugene, Lane County, we're expanding to other jurisdictions as well. So that ongoing community engagement to help us assess and start to set our priorities that are going to live in the strategic plan and in our action over the next 3 years. So November to December is really when I'm anticipating that we're getting down to the brass tacks of not just setting the ambitious goals, but working backwards from there with work plans, whether that's divided by task groups or new work groups, we'll see what the work plans really come to look like, but that development will be November and December. December and January, we're and I'll leave space for Kate and James to jump in here. I'll pause right after this before going into this overview of our workshops. But as of yet, we don't have a dead set, that's a terrible term. We don't have a hard set deadline for the strategic plan. So we can kind of flex it into January if we feel like there's more coalition building we need to do or more bridge building that we need to do. So that's just introducing some flexibility. And if we wanted a plan by December 31st, I think we could get something pretty strong by then with some intentional effort and some asks of community time. And so before I get into a little bit deeper into the progress update at this overview, I want to pause. James or Kate, do you have anything to add, and then opening it up to questions?
I don't have anything to add. No, Kate is, she's still on, she had to hop off early today at some point.
Okay. Okay. Do others have clarifying questions or otherwise about the process so far? Okay, great. So over the last month, we've held again in this heavy push at the end of phase 1 around stakeholder engagement. We've done workshops with frontline staff and service providers from 17 agencies. You see them listed here. I will pause. I know folks, we had some discussions here as well as the Human Services Commission about who we wanted to make sure was intentionally engaged along the course of this process. And so you'll see, like I alluded to, the upcoming engagement. These are really just a matter of time and time limits. So we're not at a place where anything's being decided without the groups and folks that are named in that bottom corner box also engaging. I'm expecting that to be wrapped up by mid-October. And so again, that's kind of a touch point for us to be thinking about the PHB meeting in October. Do folks want to pause here to reflect on who's been engaged so far?
I have a question, so maybe I'm missing this. I mean, I know I'm here and I'm representing, this is Lucy Venice speaking, and I know I'm representing the city. So in this engagement process, has there been a direct conversation with city staff about our investments in shelter?
Yes. And so we had planned to do similarly structured workshops, but kind of tailored to the orientation that public servants, for lack of a better word coming to mind, that it's not necessarily individual visions, that it's more about what is your understanding of the city's goals, hopes, and vision at this time. And in conversation with Reagan, realized that that's actually something better done by document exchange right now, because again, it is kind of set by policy that we're talking about visions, values, priorities. Okay. So we made a template for in that very moment that we pulled down our 90 minutes, we made a template that the city filled out. We had a half hour to debrief. But that's how we did that with the city. And now we're planning to roll that out with other jurisdictions, which is why you see local municipalities down there, recognizing that it's not quite the time for city staff to be workshopping ideas. That will come when we're in the how will we get there brainstorming is more within their scope. As we understood it inside that conversation. If you have recommendations about how we approach it differently, or otherwise, I'm absolutely open and flexible.
Yeah, no, that sounds fine to me. I just, okay. And I'll wait until you go through your presentation. Thank you. I'll just hold
sure.
and follow the conversation. Thanks.
Sure. Great.
James, how are we supporting Brittany with connecting with the rural communities?
Yeah, we've had our PSC staff who work directly on the contracts for those rural providers connect directly with them and help to make connections. We also have had, our rural street outreach team has been very much embedded in communities, and have built a lot of relationships with folks in Bonita and Oak Ridge and communities that don't have, contracted services through Lane County. And so they've been able to connect them with Brittany. And Brittany has some of has played a role in MAC group meetings as well, and of which, Bob and Mike participate in, and we often are talking about rural communities and ensuring that they're getting access. So those are some of the ways. It's just utilizing the relationships that our staff have built and that Brittany has created over her time with us.
I appreciate that question, simply as a reminder for me to also reflect just back on what I've heard through the executive order technical assistance process, and make sure that what I've heard through getting to engage with rural providers through that work is also informing here, which is something I'm trying to do intentionally, not to hold that information back, but to make sure I'm just bringing everything to the table that we have. Something else that was here in the timeline, but maybe in our discussion we may want to unpack it a little bit more. I wasn't sure how to weave it quite yet, but the system design clinic has obviously been a point of a lot of data and information gathering about the continuum of care program specifically, and how it operates within the context of kind of how homeless service systems were envisioned to function. So that data and that information is also feeding in here, and I know that they had a deep grasp of some of the challenges that rural communities are facing in particular. So that's here, and I appreciate the reminder to highlight in our data when there are specific, in the data we're gathering, when there are specific needs that folks from rural communities are naming differently or specifically. So thank you for that question. Any other thoughts before I move on?
All right, I'm gonna try not to talk so much.
Oh, no, I think this is a great place to talk.
I know we're starting to go through the data now of looking at some of the disparities in outcomes. And so I'm wondering if we can put in there to come up with a plan of maybe how we can focus some outreach and get some feedback for some of those communities where our outcomes have not been, that we're struggling with. So for example, I know how we looked at Native Americans and African Americans looking from data before, that in this process, we make sure that we're doing that and maybe reaching out to some of those culturally specific services. If the data is showing that we're struggling in those areas, so they might not be involved with the continuum of care, but it would be helpful to get some information from them about what we can do better as we're starting to look at our data of who we're being successful with and who we're not.
Just following up on that, I noticed the NAACP is not listed.
Yeah.
Yeah.
Got it.
Or Coquel, they're not on there either.
Yeah.
I do know,
Who was that?
and Brittany, maybe you can speak to this. I do know this, this represents who attended the workshop,
Yeah.
not necessarily who was invited. So obviously it was a much larger list. And I don't know, Brittany, if have a list of that you could share of who was invited, but I think we are always looking for opportunities to help make those connections too. And so if anyone in this room has a good connection at an agency or a provider that you feel is missing from this list, I'm sure.
And Brittany, and we don't have to do that in this meeting right now, but it might be helpful for, at least for me and for others, if there's places and people that we reached out to and maybe we didn't get connected, if we knew who they were, so that we can make that individual effort to reach out to them and to get feedback.
Yep, absolutely. And you mentioned, Mayor Venus, you mentioned the NAACP, and then Sean, I think you noticed another organization by name, but I missed it.
Coquel.
Got it. Thank you. Yes, I'm trying to be mindful of time. Through the executive order EO work with ICF, OHCS is also looking at how to engage culturally specific organizations in order to hopefully set up funding streams direct to them, which I know opens cans of worms, which is why I'm in the conversations, even though I don't really have time to right now. And so maybe that's just a bridge as well. Because with that hat on, I'll be scoping kind of what culturally specific organizations are proximate to homeless services across the state, and where do we see those racial disparities within the data. So I'm gonna put this as a priority, as something to integrate into the analysis by mid-October, and make sure that we at least have some initial conversations that are intentional around culturally specific providers.
So, and I think what I'm thinking is, even if they're not a part of the system, or not even interested in being a part of the system, they're probably serving and supporting folks who could benefit. And so I would like their feedback, particularly in how those of us who are involved in the system can do a better job.
And we have, sorry, were there other, before I move on, because I was just gonna, Sean, that is exactly, there's such rich information from the workshop discussions. I can't wait to continue unpacking it and sharing it with you all. But were there any other questions before I get into that? Or things that folks want to discuss? Okay. So this is what we've all been waiting for, or at least that's how I feel. This is reflecting data from the workshops with frontline staff, as well as people with lived experience. And so that previous slide of folks we still need to meet with, those were the two groups that I felt like I had a broad enough reach, enough discussions with to say, here are the priorities as they're coming up in kind of these sectors and groups of conversations so far. Some of them, they're ranked on the left column there in order of resonance and frequency. So those are the ones that came up for at least half of the participants and folks I've been spending time in conversation with about how they envision the community, the region in 30 years, what they are contributing to building toward, what they're offering. This was framed under a really clear understanding that sometimes it's hard to know exactly where to go when we may know what our values are, but we're not grounded in where we're headed or the values that we actually need to add to our ingredients list. So this was some time that folks spent in the workshops really intentionally thinking about what they hope to see and be building toward, which is a gorgeous ambition so far, a draft to set our sights on for 30 years as we scale back and say, okay, if that's where we're headed, what is the biggest and best we can do in the next 3 years? And what is it going to take of us to live in and live up to these dreams that we know we're all holding together, but we're a little scared to name that this is how big we're dreaming. So make space for those big, big, big dreams while being able to make connections to the day-to-day. So I haven't gone through these. I'm happy to. I'm just naming what's on the screen. To the left are the elements of visions that came out just repeatedly time and again, the real core themes of people's hopes for Lane County, for the entire region that encompasses Lane County. Other common themes and topics that came up, not quite as frequently, but they were just the next bracket, were comprehensive medical care. You see, I'm sorry, I didn't go through the first list, so let me do that. So we have accessible, affordable housing for all. That there were many different ideas about what that looked like. I summarized some of them, but folks named affordable housing for everybody, that we have housing that's meaningfully accessible. Similarly, mental health care. Time and again, I have heard this as the true crisis point. And the true maybe signal of where folks are most vulnerable and in cycles of harm and violence that we need to disrupt with some urgency. So just putting a pin in that throughout, not just in a long-term vision sense, but when folks who are sleeping outside today name what they need from the community, they say we need the folks who have serious mental illness. They need help first, or else the rest of us aren't going to get anywhere. It's too hard to be supporting each other when so many of us, or many of us, a good number, are in unstable crisis, but trying to take care of each other. So that was up there right under housing. Wraparound, accessible, collaborative, community-based supportive services. There were different types of supportive services named, but this was the essence of what folks would like to see for people who are not able to meet their own basic needs, or a little bit more broadly than that as well. I can get into more details as we go further along, but the need for wraparound supportive services was evident. Right next to it, safety, community connection, and respect. Taking a step back again, there is a real stark risk of violence and hate that people experiencing homelessness are currently at risk of and facing in Lane County. It's different than I see it in other places. It's sharper. The stories of violence, the psychological abuse, the tension within the community. And I think that really speaks to how desperate folks are to take action together, to understand that they're moving forward together, excuse me. So while I will continue to name safety of people experiencing homelessness as a top priority, and something that we need to look at differently as a region, for sure, as I have heard it so far, that's also something that I know that taking action will make meaningful progress toward. Last but not least, there was a lot around accountability, transparency on community-led representative public services and support systems. So some systems transformation. Who is our system run by? Someone said, I wish all of our elected officials had every element in the book so that they could understand what we're going through and what we might need. That might be a simplification of something, that's also encompassed here, but I just wanted to offer that as a little bit of detail. The other common themes and topics, comprehensive medical care, living wages. People can't afford to, no matter if they work all of the hours they possibly physically can, they still cannot afford adequate and safe housing in Lane County. And that is increasingly the case over the last 5 years. Service provider pay equity was a big hot topic. People experiencing homelessness see it too, because a lot of folks transition into case manager support roles and they find themselves right at that precarious housing and income ratio that's nearly, if not untenable. So that came up. Food security for all. There is beautiful work being done around food access in Lane County that folks are proud of, energized by. We have a lot to learn from and build on, and folks are clear. We don't need to our people fighting for food or struggling to get it. And I know the city has done a lot to pave the way to get there in recent years. And so that has rung loud and clear, both in the vision and what's working in the community right now. There's also something, and this only came up 3 times, which is a little bit less frequent, or significantly less frequent than others, but folks do name that there are some people that may choose to live outside, and that we can accommodate and create healthy spaces for them to be, so long as they have meaningful choice in housing. So when we talk about housing for all, and some folks say, but some people want to be out there, we're talking about an ideal world that we're building toward on purpose, to ensure that they have their other needs met, and then that's a true choice coming from power and self-determination. Last but not least, I did have in most workshops folks who had a longer term vision, not necessarily of what exactly we need to build, though their values shone through and could help me paint a really clear vision of a future in a generation or so. But I wanted to give space and name that people understand that returning power to Indigenous people, national reparations and racial repair, dismantling white supremacy, dismantling carceral systems, dismantling capitalism, and dismantling patriarchy are work that we likely need to do in order to really fulfill our boldest hopes for our families, ourselves, and our communities. We are in a particular political space and time where these are the voices of young people, predominantly, who are naming these things in these spaces. And so I think it's important for us to model that we hear that these are pains they are feeling. You can see that in the negativity, the dismantling, the taking apart. We are on our way to envisioning the positive of that. We're, as a society, not there yet, and who knows what will unfold next. But I think it's important for us to know that these are voices of folks in our communities who are really hurting from the current state of affairs. And these are the things that they would like to see us each individually unpacking so that we can contribute to a community that isn't perpetuating harm. Is simple. I know that it can feel highly political, but at the end of the day, being able to focus on values helped me ground in these conversations. And so that is the vision so far that we've heard from folks. I recognize we have about 20 minutes left, so I'm going to offer this values one real fast and give us the rest of the time for a conversation. We did, again, in the workshops, we didn't get into this today because I didn't stay up until 6 a.m. We didn't get into the what's working well, what's not, to unpack it, but folks did get into the specifics of, what we might be able to do in 3 years to build on what's working well and what's not working well. So I can continue that in a future discussion, but the values that folks both named and appreciated, but for the most part, that the community is prioritizing and embodying, that left column, frontline service providers, people experiencing homelessness, see and feel that and see it as a strength of the community. So there is so much to build on from the last 5 years, the last 8 years, and prior. We're on a positive trajectory. Even though we are in a middle where it feels like we are failing, so long as we accept that and be changed by it, we are headed somewhere. And I think folks demonstrated that by naming the values that they want to see us embodying in order to build the future that they hope for, that we hope for Lane County. So that is my quickest summary I could do. I could probably do it faster. I have these discussion questions, but I want to yield to Sean, you as the chair, and the group to what feels like it's important for us to unpack or get to by the top of the hour, or revisit here as well.
And look at my reports. You guys have preferences?
This is Lucy speaking again. So I appreciate all of this since I didn't go to the first day. It's helpful to hear. I guess I'm eager at the end of the workshop on Thursday. There was a list of recommendations. So I'm sort of eager to sort of dive into those and what those look like. And I don't know where that's going to happen in this process, but for me, that's the real guts of this, is looking at the recommendations that came out of that workshop.
Yeah. So that, I appreciate that, because that's something I've been thinking about, is where are we unpacking the system design clinic, and where are we weaving it together with the strategic plan workshop data? The Alliance got the very first draft of the workshop data to inform those recommendations, but I want to be mindful of time where that wasn't all synthesized. So that's something we need to do together, is take their recommendations and see where they fit inside the broader input we've gathered, just recognizing that was a narrower scope on the COC program, but deeply valuable to the 3-year plans that we have and what we can achieve in the near term and what's necessary for longer term systems change and transformation. So I think we're expecting the final version of recommendations from the Alliance over the next week or so. And again, as I finish up kind of this initial analysis over the next 3 to 4 weeks, I think we'll be weaving those things together, and you'll see come mid-October something a bit broader that certainly holds both what folks built toward in day 1 of the system design clinic and what we acknowledged and grappled with that we need to prioritize in day 2. Does that track for you, Mayor Venice? I'm not slowing anything down. It's just making sure that that data is held against, community voices. So that we're not taking expert directives and running with them, though they are the right directives. We're going to tailor it to be perfect for Lane County, given the scope of kind of engagement that you guys have prioritized through the strategic plan. Is that satisfying?
Yeah, I guess.
Is that dissatisfying at all?
I mean, I guess the question was, what do we want to be discussing in October? And I guess what I'm putting out there is I want to be able to discuss that in October.
Great.
Right, so I think your timeline works as long as that's what you're thinking. I mean, there's this, I mean, we know that we have a fundamental sort of governance challenge here about who's making the decisions and how that works. And that is going to determine so much of how we set our goals and how we use our performance measures and how we recognize the gaps in the system. So to me, that's not, that it's, I think from the city's perspective, that is a top priority, is our sort of resolving how that works, because it will determine how we bring our experience. I would say the city and the county through the PHB are aligned, but we're not actually one voice. Like,
yep.
We're making separate decisions through separate processes, and it feels to me that this whole process has to kind of resolve that in a more effective way, or help us see how we might resolve that more effectively.
I think that's absolutely right. The governance challenges that you name, I don't think that the PHB, just given the structures, this is my full candor here, given the way that the HSC is structured, given the way Oregon is structured, period, given HSC and the PHB, as well as the city's, each individual city's own housing policy groups and task forces and initiatives, the chamber's work, all calls us in here to this moment of synthesis and coming together to do a better job of collaborating, not just coordinating, I think is a theme that I've heard a lot about. The folks are eager to collaborate, to say, here are my chips, here are my goals, here are my aims. What are yours? What do we want to build together? What are our lanes in that? Where I am struggling in mapping it out, and I think this is actually just the opportunity or an opportunity forward, is that I think because the structures exist the way they do now, where we have, you Mayor Venice in the PHB, but we have the HSC with city council members, county commissioners at both, there's not a place where it really makes sense to grapple with the power and the decision making we have and decide we're going to move it. A lot of folks at the PHB might validate, yes, that's what we need to do, but that happened last week at the System Design Clinic. It's folks who have been elected or are, who have been elected, who are in those positions now, who can make those decisions. So my question is there a separate, if that's the city's priority, is hammering out, where are we as far as these governance structures, and where are we aligned as a community broadly? I think that's something that we may need to sidebar, so that there's an offer on the table for the PHB to either accept or reject, and the same with others if there's other shifts that decide to be made. But I think rather than getting stuck in process about it, we pull together the people who can really make the decisions based on the power they're given by their role in the first place. Does that feel viable? That we start to brainstorm unpacking those challenges with a group of folks, or do we need to come up with some proposals?
No, I think you're right that it's something that gets pulled away. I just I struggle with this because we did go through this process earlier this year of defining what the HSC's role and authority is and what the PHB's role and authority is. So we sort of set that up, and then we've gone through this design workshop and said your governance structure doesn't really work right. And so I just don't know. I don't know where the bandwidth is or the timing. I mean, I don't know how far to go with that, except we've all acknowledged that there's a challenge there. So it probably is a separate conversation. PHB does need to do their strategic planning. There's a timeline. I don't want to slow that down, but I also don't want this sort of essential component to be totally sidelined, that it's a separate
Yeah.
conversation. So, you know, I'm not sure how to proceed, but I just don't want it to sort of leave the table or be something that we say, to me, this was the single most significant recommendation that came out of that design workshop, the most critical piece, and it's the one that is the hardest for us to deal with.
I don't think it is the hardest for you to deal with, but I don't want to be naive. And I hear someone else.
Oh, and I was gonna say, part of it is that transparency part, I think, within the system that came out of the system design clinic and what's actually coming out of the data. Because I know somewhere in there, I think for a lot of people, we think we understand the process, but I don't think it's clear with all the different committees and the elected officials. And so, and I don't know that in regards to the Poverty and Homelessness Board could make a recommendation based on what, or support the recommendation. But I think part of that piece of just making sure that we're transparent about their recommendations. But from what we're hearing from people is that even if we don't go down that route, or that's not within our scope of, that there probably needs to be some transparency about how the system works and what's the yours, mine, and the ours piece. As we're even if we continue to move forward with the system as it is, because I think it's confusing for everyone, and that's where a lot of the frustration comes in with people, is that not understanding how it all works together.
And I do think there's an opportunity to have that conversation in the October meeting too. And really make sure we're kind of setting the table for that conversation and making sure there's a, you know, this is the PHB, this is the HSC. You know, I think those conversations have happened, but we also have new members and it's a complicated structure. And so I think making sure that we're revisiting it frequently may be helpful.
And I think a way for the community to understand too, because I think they come to the Poverty and Homelessness Board, community members, when they're frustrated.
Right.
So it's like, okay, well, we kind of understand it, but to address the transparency, I think that piece is that the community they have to understand it without feeling like they have to come to us.
You know, so I will, this is Lucy again. So I would just say, you know, if this all worked exactly the way I would like to see it work, we would all be in one voice. We would all say, this is our strategic plan, and the rural communities and Eugene and Springfield and Lake County, we've all agreed, like, this is a good plan. And we've all identified what our respective parts of that plan are, so that when we're thinking about beyond the continuum of care, when we're thinking about the people who are living on the streets, moving through the system, we're looking at all of the pieces. And so I think the challenge that we have is that, you know, that we have cities in particular making separate decisions that are not referencing a common goal necessarily. And what we're trying to get to is that regionally that we have this common vision of how we're doing it and what each role is. So to the extent that we're moving in that direction, I'm going to be happy.
To be honest, so I do want to touch on the reimagining work that you all did. I think it makes good sense. And I think that work may have had a 6-month or 9-month tail on it that we didn't see. I think the reason that folks are feeling ready to maybe do a little bit more or refine it, or, you know what, we have to set the table this way, because that work was done and you had a chance to sit in it, live in it, experience it. I think tech has taught us that things thrive when we fail quickly. And that's not to say it's a failure. It's because we're learning. That's just what learning looks like. That said, you have, between the Alliance team and I, we could probably structure some options of what it might look like to go down those paths of either holding things as they are, but working toward transparency, accountability, clear lines between goals and implementation, and what it might look like to wrangle that together from where we are, tables set as they are, and then maybe a few options looking otherwise. With a painful 6 minutes left, I would be remiss to say that.
And we are okay.
How we go to
We're good.
disaster or something,
Yeah.
Oh, fabulous. That's the best news. I just want to name that I think there's an opportunity to put some cards together with the Chamber of Commerce's work, and figure out how we get some collective wins there. The pain points, you guys, I almost can't stand being in town because it's like I'm a mirror or seeing mirrors of each of you and each other. And I'm like, no, don't you see? It's just the inverse pain of this one. But the Chamber's work is exactly getting at this, or seeking to, but
Right.
from a specific perspective and vantage point, with priorities that are important and need to be held. But when we haven't acknowledged where power really truly lives to make these things happen, we get lost in the muck. And it takes courage to say, you know what, we've gotten this far and it's been fabulous. We need to keep transforming it before we create what's new. And I see so much space in the Chamber plan to create something that we actually put all of these things together. Working with a broader, maybe swath of elected officials than we have directly at the table. Making sure that folks who might often feel marginalized from these conversations actually see that they do have a seat, that they are engaged with, that they are held accountable, and vice versa. We have to practice these things. So I can loop back on this later, but it does feel like something that the Alliance, maybe in an hour or two workshop together, we might be able to start sketching some ideas and options, and bring it to either this group or the broader, preparing to get into it a little bit with the broader PhD in October too.
Great. Sounds great. Thank you.
So I'm curious, where do folks have any outstanding concerns or questions about the process, or where we're headed from here? Okay. So my next steps will be to get some time with the Alliance, on two different paths, I think, to make sure that what we bring in October to the PHB is a synthesis of building on the system design clinic and the strategic planning we've done, to level set where we are and our recommendations and findings so far, as well as kind of some of that governance thinking and work on the side. I do have a meeting with the Chamber at the end of next week. That's just a one-on-one. So that's fully open book of kind of digging into each other's work, I think, a little bit. And so I'll continue to feel out opportunities there. I do just want to name that, and I know that the Chamber's plan was discussed at the System Design Clinic. I apologize if I made any remarks that sounded derogatory toward it. They were immaturely reflecting my pain, that I see folks wanting so badly to make change and to do it together, that we're just stepping on each other's feet as we find our way toward that. And there's so much integrity in it when you step on someone's feet and try to figure out the truth of a situation. And so if folks have advice or concerns, or thoughts about how we might hold that relationship with the Chamber in a way that helps us all get to what we know we want to do together, I am all ears, because not every community has that energy from the private sector, and quite frankly, it fills other deficits that the community has as well. We don't have philanthropy at the table, but my goodness, you have business leaders who want to make a difference, and that's beautiful. James, is there anything you need in prepping or wrapping up here from me?
I don't think so. I mean, similar to Mayor Bennis, I'm excited to really dig into it in the October meeting, and to go over the recommendations with an NAEH. But no, I think you did a good job of setting that framework today.
Right. Well, thank you all so much. As I get further down the road of synthesizing information, gathering more, you'll see more updated from me. In what format, I'm not sure. I don't want to give you an interim report, but I do have some good data that I'd like to share with folks. So you'll be hearing from me soon. And I so appreciate the time everyone took inside conversations and otherwise last week to get me into the community a little bit more deeply. I really adore you all. It's just a delight to be working there, really. So thank you.
Thank you.
Thank you. I was gonna say, Brittany, just the slides that you showed us of getting the feedback from everyone, that feedback is something to share with the business community, the jurisdictional, and using that as a platform of how we can all work together to create a plan that is the vision of the feedback that you're getting from the people in the community. And we all have different roles to play in that. So I appreciate gathering all that data, because to me, that's the first shared data set that we have to use amongst everybody. This is what we've gotten back from the community. This is their vision. And that our role is how can we support the community in our different roles to move towards that.
And Brittany, that actually brings up a question for me. I think likely many of the folks who participated in those workshops with you and provided that feedback are likely not folks that are regularly tuning in to PHB meetings. So I'm curious if you have a plan to kind of share with those folks who provided that feedback how it's being used and steps that are being taken, just because I think we hear a lot from our providers that we solicit their input and their feedback, and then it's unclear how that's used. So I would want to just make sure that those folks that may not be continuing to tune into this ongoing strategic planning process are kind of hearing how that information is going to be used. And maybe you already did that in your meetings with them, but just curious.
That is so helpful, James, as something to name for us to practice. And has certainly been my intention. So through the workshops, we did have folks, if they were interested in engaging on this further, flagged it for me so that in the conversations down the road, I can reach out and schedule around them in particular, since they've offered and wanted to be engaged, recognizing that we can't keep asking organizations to invite their whole staff, that not everybody wants to do this, but that there were folks that really wanted to see it through. But I appreciate that, reminder that it'll also be helpful to, maybe ahead of that, whatever the send aheads for the October meeting are, to share that with folks that were in the workshops. And if we can get wheels on track soon enough to get their feedback beforehand, so that we're making sure we're using what they provided with integrity. There are some quotes this is why I was up until awful hours of the night. There were just gorgeous quotes that I was starting to pull from folks and seeing who said it so that I could go back and say, without your name, would you mind if we shared this with others? Because it's incredibly moving how you see your day-to-day work with folks or folks experiencing homelessness who just reflect and see the community so poignantly. So James, thank you. And absolutely, I will make sure that that's a part of the process sooner rather than later. I apologize. I also need on my follow-up and next steps, Sean, to follow up with you on culturally specific organizations and providers in that body of work. That is also on my radar and to-do list.
Well, thank you, Brittany, for the presentation and for staying a little bit longer. We all look forward to moving this process along and working towards the strategic plan.
Absolutely. Thank you for having me. Take care, everybody. Good to see you all.
Thank you.
Bye.
So we are to jurisdictional updates. And I know Mayor Bennis is here. I thought I saw somebody from Springfield.
Aaron.
Mayor?
Yeah, I think Aaron was.
Okay. Mayor, would you like?
I'm not sure what I've got in updates. that are pertinent here. I mean, there was a wonderful groundbreaking yesterday for the new Alma apartments in Springfield that got federal home funds and more local funds from Springfield. So Erin may want to speak to that. But that was exciting to do. City of Eugene is, we had a public hearing. We're looking at, we have a multiple unit property tax exemption, 10-year exemption that we offer to developers in the downtown area in exchange for, among other things, a percentage of the units being more affordable or paying into our Affordable Housing Trust Fund. And so we're looking at having a streamlined version of that just to create a little more housing opportunity in our core downtown, because it's so hard to build housing in downtown. It's just, there's small lots, you have to consolidate lots, you're building an already built, there's just a lot of complications to doing that. So we had a public hearing around that. So that's interesting. We'll see how it goes. But I think council's pretty committed to doing that. And there's this interesting question in the city of Eugene about whether we have too much affordable housing already downtown. And so, maybe what we need is more market rate housing. So it's interesting balance as we try to meet the need for affordable housing and also meet the need for market rate housing and where and how we do that. So just an interesting conversation happening in the city right now.
Erin, do you have any updates for Springfield?
Oh.
Sure. I guess I'll just add to Mayor Venice for the groundbreaking for Alma Apartments. So that's Cornerstone's project. It's 39 units of affordable housing, and 10 of those units will be set aside for the nonprofit Hope and Safety Alliance. So their clients, so they'll be paying rent there, but being able to sort of place domestic violence survivors in those units. I guess I'll add, currently the cities of Eugene and Springfield have 2 RFPs open for federal funding to be put toward new construction of affordable housing. That is our normal fall RFP process. So there's funding available for new construction in both Eugene and Springfield. I think those applications are open. One is open for another month. One is open through January. I think the final piece for CDBG funds, the city of Springfield recently was able to award funds similar to the way Eugene has, which is to support new in-home childcare businesses. And so these are folks who are going through a program through Lane Community College's Small Business Development Center. I believe it's a 4-month program to sort of get their in-home childcare business up and running. And once that becomes licensed, they are supported with a $5,000 sort of startup grant. Eugene's been partnering, and Springfield is now just partnering to be able to support those new businesses, which I think can take on 12 new kids, or 10 to 12 new kids, I think, per home. So we can support 5 new businesses. We're talking 60 new childcare slots. So small but exciting. That's what I got.
Thank you, Erin. And Mayor, did you want to add something?
Yeah, I guess I was just going to add that there's this sort of a statewide conversation happening around sustainable shelter, and Governor's Office and Representative Pam Marsh leading a series of workshops. And so the city of Eugene is participating in those. And it's interesting because it's addressing this sort of the same challenge, certainly the same challenge that we see from the city's perspective of needing to invest in shelter because of the crisis on our streets, and also that doesn't fit into the eligibility standards for a lot of the funding streams. So we face that here locally, and it's part of the statewide conversation as well.
Thank you. Okay. And then with that, you are up, James.
And I do have a couple quick just Lane County updates in Pat's absence, Commissioner Ford's absence. Just as many of you probably know, the Lane County Mobile Crisis work is up and running, and they have been keeping busy, and are looking to hire staff still for that. The deflection program, which I believe has been discussed at the PHB, they are slated for an October 1st start, so we're getting close. They do currently, and it may have closed by now, but there's an RFP out for a specific shelter for to be used for deflection. So to be able to provide an in-the-moment shelter for those folks that choose deflection, so that they can stabilize in the shelter while they're awaiting the treatment opportunities. And then I did just want to highlight for this group, the MAC group was presented an opportunity to apply for a new state pilot program called the Housing 360 program, which is really focused on providing funds and supports related to housing stability for folks that are experiencing behavioral health and substance use issues that may jeopardize their housing or their ability to get into housing. And it was a unique opportunity in that the state was allowing MAC groups to decide whether or not the MAC lead would apply for those funds, or if a provider could apply directly. And Laurel Hill Center, in collaboration with the MAC group, submitted a proposal directly that's really aimed at, and it's something that we hear often from our shelter and street outreach providers. The goal would be to provide supports that transition with households as they move from homelessness into housing. So we often have heard, shelter providers say, as soon as folks leave our shelter and get into housing, and if they're not connected with a program, those supports that we have been giving them in shelter don't, transition with them to housing. So excited to see, to hear if our local proposal is chosen. The state is anticipating funding 3 to 4 regions, MAC regions. So, there's the potential for that funding. It's by no means a guarantee, but just want to put that on folks' radar. I think it's an exciting opportunity that could be giving to the county. That's it for the updates on Lane County. As far as the October meeting, I think we talked about it here. There'll be the piece Amanda said we need to make sure there's some decisions to be made around the COC funding and the NOFA. We had talking about the coordinated entry, the new youth assessment tool. I want to make sure we have enough time to have a really robust conversation about the recommendations from the system design clinic. So I'm thinking we may bump that one to November just to make sure that we can really fully engage in conversation on that topic. That's what I've got.
Any feedback on the? Okay, are you guys gonna be the youth, since you're connected to the
Yeah,
youth,
no,
are they
I had a
gonna be okay
discussion.
with that?
Yeah.
Okay. And with that, we are at our wrap up. So there was no decisions made today. There was some feedback given to Brittany in regards to giving the Poverty and Homelessness Board some information of folks that maybe she reached out to give feedback who didn't respond. And then also supporting Brittany to connect with some culturally specific services, whether they're involved in the COC or not, just to look at our data. So we know about the culturally specific, but looking at our continuum of care data and making sure that if there are disparities in our success and engagement with populations, that we are reaching out to social service agencies and providers who have contact and relationships with those groups of individuals. And then it's right here. We're going to talk about the system design clinic debrief, and Brittany is going to reach out to the Alliance to see how she can interweave what they have given for feedback along with the strategic plan and the progress that she has made. I think I got, and then we have on the list, although now I'm excited to hear that Cornerstone is going to have some units devoted to domestic violence, but that we need to keep that on the radar and start looking at that now in preparation for next year of how we can start working with providers of housing and domestic violence, services to be able to hopefully be able to submit a project in 2025 for the domestic violence portion of the COC funding. And I think our next meeting is October 17th at Harris Hall, all member. I think I have wrapped up everything.
you have.
Nice job.
With that, our meeting is adjourned. Go out and enjoy the sunshine.